We hear the same explanations for the NHS crisis every day. The headlines point to a familiar list of causes: funding shortages, management failures, and administrative backlogs that leave emergency rooms overwhelmed. This is a national public service bound by a legal constitution. It is a system of public duty, not a corporate enterprise trying to balance its books. Vulnerable patients are legally entitled to care based on clinical need. No amount of bureaucratic language regarding systemic delays can erase that statutory reality. Classifying ongoing failure as a management issue strips the system of its constitutional obligation to protect the public. The legal power to intervene in failing healthcare systems exists today. It is written into the legislation governing the service. Under Section 13ZC of the NHS Act, the Secretary of State has the direct power to mandate action from NHS England. Simultaneously, Section 14Z61 allows NHS England to step in and direct local care boards the moment they begin to fail. The levers of control are already in place. Despite these powerful legal levers, responsibility vanishes into the bureaucracy the moment a patient is harmed. This creates a constitutional control gap. Statutory power is clearly defined at the top, but it shatters into dozens of disconnected nodes before it ever reaches the patient at the bottom. The system uses administrative complexity to insulate itself from legal accountability, despite possessing the clear authority to protect patients. The government maintains a continuous cycle of restructuring. We saw the Health and Care Act of 2022, followed by the 2023 transfers that folded NHS Digital and Health Education England into the central authority of NHS England. These consolidations were presented to Parliament as a way to streamline care and reduce the fragmentation that had paralyzed previous versions of the service. Shifting these administrative boxes merely obscures the chain of command. By redrawing the map, the system diffuses blame, making an identifiable line of responsibility impossible to trace. Continuous structural change provides a permanent smokescreen, shielding duty holders from being identified when the system fails. Consider how this looks for a patient with complex physical and mental health needs, attempting to navigate this architecture during a crisis. In a medical emergency, two constitutional questions should be easy to answer: who holds the duty to act, and who holds the risk of failure? Primary, urgent, and specialist services use contractual boundaries to deflect responsibility. The crisis enters a liability loop between silos. Who intervenes, reports to Parliament, or offers remedy? No answer. The patient must coordinate their own emergency care, bearing the full weight while in collapse. The administrative rules functioned perfectly to protect the institutions from liability, leaving the patient to navigate the crisis alone. The government has already announced another massive disruption for 2026, planning to abolish NHS England and shift to a neighborhood health model. Launching a new structural reorganization is a profound risk when the government has yet to prove that the 2022 and 2023 reforms ever delivered their promised benefits. Official parliamentary scrutiny has already identified severe gaps in how patient safety recommendations are tracked and implemented during these transitions. The machinery of oversight is failing to keep pace with the changes. Pushing a new layer of complex reform onto an unstable foundation is constitutionally reckless. Before any future NHS reform proceeds, we must require a formal constitutional impact assessment. This assessment would provide an explicit map showing who holds the statutory duty, who holds the risk, and exactly how a citizen seeks a remedy. The public is desperate for basic safety and accountability. That demand is being ignored in favor of creating new structural agencies. The rule of law demands that public power remains visible and answerable, rather than existing only as a theoretical authority on paper. Responsibility and authority exist. They are sitting unused while the suffering continues. That is the actual scandal at the heart of the system.